also present to you Dr. Karen Chang, a fellow Hakka born in Trinidad and Tobago in the West Indies, who obtained her medical degree from the University of the West Indies. After immigrating to Canada, she continued her specialist studies in pediatrics and neonatology, with more in-depth studies on prenatal, neonatal, and infant illnesses. She received this training from many diverse programs at the University of Toronto's Sick Kids Hospital, University of Ottawa's Children's Hospital of Eastern Ontario, and finally Queen's University's Kingston General Hospital. Within the last 30+ years, she has been working at Centenary Hospital, where she was Chief of Pediatrics for 10 years, was instrumental in the building of the neonatology wing from ground up, and continued serving passionately, taking care of so many babies and children from prematurity to teenagers until amalgamation to Scarborough Health Network. Ladies and gentlemen, I present you with Dr. Karen Chang, and afterwards we're going to have a question and answer segment, if you guys are interested.
Thank you, Ming. Okay, so I'll review some of what it is, but as I'm a pediatrician, more what I'm saying is going to be related to pediatrics. Okay, so as you know, COVID-19 infection, hello? Yes, can be asymptomatic, which means you have the virus but you don't produce any symptoms. And these are the, unfortunately, kids that can spread it around to everybody without you being aware. Then you can have mild to moderate infections, which is the majority of the kids. But as you have more and more kids getting infected, you're going to have more and more kids being hospitalized, even though they're mild to moderate. And then they have the severe infections, and kids can still get quite sick and have to be hospitalized. So symptoms, as you know, generally can be fever, chills, a little bit of cough, a stuffy or runny nose. They can vomit, they can have diarrhea. One of the major things we look for is whether they are poor feeding. Because as you know, the kids don't tell you a lot, but if they're not feeding well, they can get dehydrated and have a lot of other problems and difficulty breathing. They don't have to have them all, they can just have one or two. They have sore throats, they can have headaches, they can get very tired and sleepy, they can have joint pains, muscle pains, and not so much in the younger ones, but so the older kids, you can say they're not tasting anything or they're not smelling anything, which is what is more common in the adults. And they can have chest pains, again, more the older kids and the adolescents. Treatment, essentially, we don't have a lot of treatment, but for symptomatic, so we treat the symptoms. And so you give them antipyretics to treat the fever, you give them, make sure they take lots of fluids, you give them anything for the pain, again, and you have them sleep, and kids are great. If they don't feel well, they're the ones who are going to rest. If they're running around and stuff, we know that they're not that sick, unlike adults. And nose drops, if they're very stuffy, and humidity helps them breathe better. So treatment, if you are sick enough, you have to be hospitalized. And these are the kids that are not drinking well, and so they often have to have IVs to hydrate them. And there's a possibility they might have secondary bacterial infections. As you know, viruses don't respond to antibiotics, but if you have a secondary infection, antibiotics may be necessary. And if they are having problems breathing, they may need oxygen. And in the more severe cases, they may even need help with ventilation, with a machine to help breathe for them, because they get very tired when they have difficulty breathing. So we can make a diagnosis based on the symptoms, and obviously if you have a contact, like if the parents have COVID and the kids now have symptoms, it's more likely that they also have COVID. And we do a definitive diagnosis with the nasopharyngeal swab. As you know, everybody has a RAT test, a rapid antigen test. These are helpful, but they're not 100% accurate. So initially, they may be negative. The PCR test is much more diagnostic. So, as Dr. Lin was saying, the spread from infection is from people to people, and it's passed by coughing, sneezing, all these other things that he's already mentioned. And you get infected by breathing in the virus. So that is, again, where the mask is very helpful. Infected also by touching things. So you touch something, then you touch your nose, your eyes, or any mucous membranes, and that can also spread the infection. And the virus can stay on surfaces from hours to days. So that's, again, very important. That's why washing hands is very helpful in decreasing the spread. And obviously, as you know, indoors, you're more likely to get it than outdoors. So in children, the risk is highest when you're under 1 year of age. If you're obese, if you have diabetes, and from the age of 12 to 17, if you have asthma, that increases the risk of severity. Congenital heart disease, chromosomal abnormalities like Down syndrome, and if you have other problems, immunocompromise, etc., as we said, these all increase the risk of you having a more severe form of disease. Now, in children, specific to children, not so much in the adults, is, the adults do get myocarditis, pericarditis. Myocarditis is the inflammation of the muscles of the heart. Pericarditis is the inflammation of the lining of the heart. And this can cause problems, obviously, because it affects your function in the heart. MIS-C, or what is called multisystem inflammatory syndrome in children, that is more specific to children. And it often occurs a few weeks after having had the infection, and it's an inflammation of multiple organs. So you can get very, very sick, and these kids are often hospitalized. They do eventually recover, but they do have a period in which they can be very, very sick. And then there is the COPS, the long haul syndrome, which can occur in children also. The unforeseen effects in children more so than the adult is the isolation, what it has how it has affected them. Obviously, it's been the school, because they haven't been going to school, and depending on where you are, what your schooling is like, so a lot of them have fallen behind. The social interaction that the kids normally have, and they no longer have, so it's very different for these kids who have gone through this 2 years compared to pre-COVID. Depression and behavioral problems have increased dramatically over this COVID period time, and unfortunately, we've seen a lot of eating disorders. So we have had multiple hospitalizations for kids with eating disorders. And in the family situation, if you have a poor family situation, or if you're stuck together all at once, you don't have a break from each other, there's increased risk in the family of abuse. Prevention, again and again, hand washing, wearing masks, and physical distancing. So immunization, on top of that, as we had talked, is great for prevention. So it prevents the infection, it prevents the spread, because you have less virus, it prevents severe illness, it allows the child to stay in school, so they don't, every time they're in contact with somebody, it doesn't necessarily mean to say they now have to isolate themselves. And it allows safe participation in group activities. As I said, immunization is a process by which a person becomes protected against a disease through vaccination. And vaccination is the act of introducing a vaccine into the body so the body can produce antibodies against that specific disease. And as Dr. Lin said, antibodies are like the armies that fight the infection. So immunization, what happens is you introduce the virus particle, it is not live, and it stimulates the cells in the body to produce the antibodies. And the body now has the ammunition, so it's to fight the infection as soon as the virus enters. So it either prevents the infection completely, or if you do get infected, it's not as severe. So immunity is provided by the antibody. And the antibody levels, as we said, falls over a period of time, but you do have a memory that persists in the cells. And the higher levels result in longer protection, and it's also found to be better against Omicron. And the protection is against serious disease. So that is why we say you can still get the infection, but it won't be as severe. Now, the mRNA, as you know, has gradually been introduced to the children. First it was from 12 and above, and then it's 6 or 5. It depends on which one. The Pfizer is 5 and up, and the Moderna is 6 and up. And the dose is different, so it's less than the adult dose. Side effects, as with the adults, is mainly local, which is pain, swelling, or redness at the site. You might have some mild general side effects, which is the headache, the fever, the fatigue, the muscle joint pain, and swollen lymph nodes, especially with the Moderna. So the serious side effects that everybody is always concerned about is allergic reaction. And anything you give to the body that's not part of your body can produce an allergic reaction. So you don't really know you're going to have an allergic reaction until you actually get it. And if you do have an allergic reaction for the first one, then you don't get the second. That's why they keep you and observe you for a little period of time after your first dose. The second one, for young adults and essentially older adolescents, mainly the male, is they do get a small percentage will get an increased risk of myocarditis and pericarditis. But these are actually transient, and most of the time it will resolve over a period of time. So vaccines, as you know, are given at an interval initially of 8 weeks. The manufacturers had initially done the studies with 3 weeks, but because initially they didn't have enough vaccine, they increased the time, and they found actually with a longer interval, you got better response in the antibody levels, and that's why now the time interval is much higher or longer. The longer intervals also decreases the risk of the myocarditis and pericarditis side effect, and as we said, every dose you get, the higher the level of antibody you produce. If you have an infection, you wait at least 8 weeks after the infection before you get your dose. And if you've gotten 2 doses and you got an infection, then you wait again for at least 3 months to 6 months before you get the 3rd dose. The booster is still recommended, as we said. Now they go from the 12 to 17. They haven't said yet for the 6 years and up, but the 12 to 17 years, it's recommended to be boosted. 6 months after the last COVID vaccine, or 6 months after the last COVID infection. Now, why should you get vaccinated? And Dr. Lin went through all the reasons why you should, and it's the same for children. Everybody says, children don't get that sick, why do we need to vaccinate them? But it's still important because you still have the chance of getting infection, which can be quite severe, requiring hospitalization. Now, it'd be sad if you said, oh, your child is not going to get that sick, and you're the one whose child gets very sick and has to be hospitalized. Also, as we said, MIS-C, which is the multi-inflammatory system disease in children, can get them very, very sick, and they often have to, initially they were in the intensive care unit for quite a while. So if you can prevent that, I'm sure as a parent you'd want to do that. And it does help decrease the spread of infection, even if you don't get sick. And I know you're just worried about your child and the effects of the child, but it does affect the whole family. And again, you decrease the risk of the long-term after effects. And it is safe. The studies were done, I mean, admittedly the numbers were not that great initially, but the Health Canada goes through all the studies to ensure there's safety before they actually have you have the vaccine. And the vaccine is continually monitored, even after it started. And we're very lucky that some people actually take the vaccine, because you have millions of people before it gets to us to say, yes, it's safe. And also they continue to monitor it. Health Canada continues to monitor it. The Public Health Agency of Canada monitors, even after it's gone in the market. And again, the vaccine manufacturers also continue to monitor it, because things may change. But at the present time, it's a very safe vaccine, as vaccines go. Nothing is ever 100%, but the percentages of side effects are low. Okay, I hope that sort of encourages people to have their kids vaccinated, together with all the good things Dr. Lin has mentioned, why vaccines are great. Any questions? Just remember, vaccines give you antibodies, which are the army to fight. And the boosters will help increase those armies. It also gives them memory so that they start producing the extra ammunition as soon as they get in contact with the virus again.
If anybody would like to ask a question, there are microphones in the middle of the aisle. If you're interested in finding out some more or something wasn't clear.
Having a booster, is the Pfizer or the Moderna more effective?
Sorry.
I heard that the Moderna was more effective. Is that true?
Yes, I'll tell you about the dosing of the shot. I'm just going to take this off here a bit more. So the dosing of the shots were different. Okay, so Pfizer is 30 micrograms of the mRNA stuff in it, and the Moderna original shots were 100 micrograms. So therefore, the antibodies from the Moderna shots give you more antibodies. That's also probably why it has a little bit more side effect, because we're giving you more of the stuff in it. So therefore, the antibody from the Moderna does have more. And when they looked at US databases, there seems to be a little bit better protection over time with Moderna, if you look at Moderna versus Pfizer. For the booster, they dropped the amount. So Moderna went from 100 to 50, and Pfizer is staying at 30. So we're much closer now. So therefore, Pfizer and Moderna for the boostering is a little bit closer together. One is 30, one is 50. In Ontario and in Canada, we're the only country that says for 7 years and older or immunocompromised, we recommend Moderna, 100. And that's because we've done some good studies here with the transplantation people where they use the higher dose and you get more antibodies from that. So this is probably where you're hearing this stuff from. The Pfizer one that's coming out, the double, instead of, they've tested 30 and 60 units of the stuff. Moderna will continue to be 50. So for Moderna, the first two shots were 100, the booster is 50. In Canada, if you're older, over 70, or you have immunocompromised, the recommendation is 100 for those people. We're the only country that does that. So that's the difference between the dosing. And the dosing does, it is important, because for the Pfizer one, when they went to the little children, they went lower, like they gave a little too low, because they were hoping less side effects with lower dose. And 2 shots wasn't enough. So that's why for the little kiddie dosing, under 5, it would be 3 shots for Pfizer and 2 shots for Moderna. So it's going to get a little bit more confusing, but we just have to make sure that we keep track of these things, because the dosing seems to matter. Having said that, if you've been doing Pfizer, then at least we know what your side effect is, right? So when we introduce you to something else and then you have side effects, that's not good. So I've had a lot of people saying, well, if the difference is between 30 and 50, I'll just stick with Pfizer if they've been on Pfizer all the time. Because every time we introduce something new, there's a chance of more side effects from that side. And so therefore people will say, oh, I should have stuck with that. So I have half and half of the people. You know, some of them just say, I want to finish with the same brand, and other people will jump across. But definitely more people have had Pfizer throughout. And as you saw, Pfizer will boost you up nicely, but maybe just, you know, a little bit more with the Moderna versus the Pfizer, and that's it. So not a huge difference, but there is a slight difference between the two.
With pediatrics, essentially, the Pfizer, less side effects, the Moderna, more side effects, but the Moderna apparently does give you a longer immunity.
Well, I had the Moderna and quite severe local reaction. And I was thinking of taking Pfizer for the 4th shot. Do you think that's wise, or should I stick to the Moderna?
When did you have the bad reaction? Like, is each shot?
Every shot.
Every shot. And is it the same reaction, or is it getting worse?
The same, I think.
The same, yeah. If it's the same and it was short-lived and no breathing issues, nothing like that, then probably Moderna, you stay with it, because your booster dose, if you're under 70, you look young. would be 50. So you'll actually get half the amount of drug. So therefore your chance of having side effects would be lower. So whereas if you switch over, you've already had 3 Modernas, let's say, and your 4th would be a Pfizer, then now you're introduced to a new shot. So could you have reaction to that? The answer is yes, you might be. And because you're getting a booster that is going to be 50, it'll be less than your other shots, then hopefully you'll have less side effects on the 50 shot versus the ones that you have.
So I should stick to the
Stick
Moderna.
with that one, yeah.
Make sure you take your anti-inflammatory right afterwards and continue for a few doses.
Any more questions? Now that you have very professional, experienced people here to answer all your questions. Everyone, our Hakka Member of Parliament, Sean Chen, who we saw earlier via video, has managed to fit some time in to come to speak with us. Our very committed, hardworking, he takes good care of us.
Thank you very much and good afternoon, ladies and gentlemen. 大家好嘛，大家都記得冇？我聽到要少做過要壓嘅味道嘅 ，so I just said that. I heard there's some delicious roasted pork and duck coming for lunch, so I'm not going to keep you for too long, but I do want to say thank you to 3 different people, and I'll start off by saying thank you to our amazing health professionals, our doctors who have shared some wonderful information for all of you. And we all know throughout this entire pandemic, our frontline medical, healthcare, and essential workers have been there to support us, to help us, and to make sure that we are all safe and protected. So let's give a big round of applause to our healthcare professionals. The second people I want to thank are the Chinese Cultural Center of Greater Toronto. You see this banner, it talks about the Immunization Partnership Program, and this is a $64 million fund that our federal government established at the beginning of the pandemic because we realized that there were underserved and marginalized communities who were not getting access to vaccines. And either there was vaccine inequity or there was vaccine hesitancy. And a lot of that had to do with misinformation or disinformation. So through the fantastic work of CCC, a grant was given to them to work in partnership with a number of different organizations to promote information and education on vaccines. And so today's event is possible because of the IPP program, and I was very pleased to announce just several months ago the $330,000 that went to CCC to support this initiative. So thank you to CCC, and I know Angela, President of CCC, is here today. Thank you, CCC. And finally, I would like to say thank you to the Toronto Hakka Heritage Alliance because this has been an incredible celebration of our Hakka culture. And I look around and I see so many Hakka diasporas from all different parts of the world, and we are united by our common Hakka spirit. We of course recently just had the World Hakka Conference, and I want to acknowledge my cousin, Regional Councillor Jolie, who really spearheaded that initiative, and we had a fantastic event just recently. So it's great to see all of you back here again, and thanks to HHC for their work to make this event possible. So big round of applause to our Hakka Heritage Alliance. And I do have a congratulatory message I'd like to present to Karen as the chair, and I will say to all of you, thank you for being here. I hope the information you take today, you will spread, you will educate and share with others. And I know it's tough, sometimes you have questions and they say get up to the mic. I want to share with you, there's a great program at Scarborough Health Network called Vax Facts. So you can search up Scarborough Health Network Vax Facts, and they provide private, confidential consulting with a medical professional. You can do that on the phone. and they'll answer any questions you might have about your health and about vaccines. So thank you so much. Have a great day, and I hope you enjoy the lunch. Thank you. Docha Taiga.